we're jumping right into a tiny pill that has almost certainly rescued you from a miserable afternoon at least once or twice. I'm talking about ibuprofen, the hero, the anti-hero, and the science of pain. Today, we're mapping out a wild biological journey, starting from its absolute heroism deep inside our cells, all the way to its unexpected and honestly kind of shocking dark side.
And you know, this brings us to the core question of our explainer. We pop these little pills without a second thought, right? But how exactly does ibuprofen work? And is it actually safe for us to use on a regular basis? It's a question you absolutely need the answer to before you go opening your medicine cabinet again. So let's dive right into section 1. Meet the painkiller, a familiar face.
Now, you probably know this stuff by a few different aliases. Whether you're calling it Motrin, Ibu, Nurofen, or literally any of its 50 other brand names, it's all the exact same powerful stuff. We reach for it to treat a whole host of daily annoyances, you know? Inflammation, general pain, fever, a nasty toothache, cramps, and even arthritis. Basically, whatever ails you. But to really understand its true power, we have to look a bit closer.
Moving on to section 2, the science of pain, a biological chain reaction. Let's walk through the step-by-step biological journey of pain just to see what happens when we get hurt. Step 1, your cells get damaged. Maybe you stubbed your toe or strained a muscle at the gym. Step 2, those damaged cells immediately release a chemical called arachidonic acid. Step 3 is where the magic happens, guys. An enzyme in your body called cyclooxygenase, or COX for short, swoops in and converts that acid. And that leads to step 4. The creation of prostaglandins. You absolutely do not want prostaglandins hanging around because they're the very things that promote pain, fever, and inflammation in your body. It's just bad news.
So how does our little hero actually save the day? Well, ibuprofen works to inhibit that COX enzyme. Or to put it in slightly more humorous terms, it COX blocks the arachidonic acid. I know, it's funny. But by standing in the way, ibuprofen completely prevents the production of those nasty pain-promoting prostaglandins, which just cuts off your pain and fever right at the source.
Which brings us to section 3, ibuprofen versus paracetamol, the anti-inflammatory advantage.
If you've ever stood in the pharmacy aisle just staring at the boxes, wondering why you should choose one over the other, this is a huge point of focus for us. Both of these medications are fantastic at reducing pain and bringing down a fever, because they both inhibit that COX enzyme. But here's the massive health benefit of ibuprofen. It has a distinct anti-inflammatory effect that paracetamol simply lacks. So if you're treating issues driven by swelling, like sore muscles after a workout or joint pain from arthritis, ibuprofen holds the clear, undeniable advantage.
All right, section 4, fever and clot prevention, the bonus benefits.
Time for our word of the day, vasodilation. Vaso means vessel, like a blood vessel, and dilation means becoming wider. Ibuprofen actually acts directly on the hypothalamus in your brain, triggering this vasodilation. By widening the blood vessels, it brings them closer to the surface of your skin. It literally works like a radiator, cooling down your blood and drastically helping to reduce a fever.
But wait, there's another hidden function of that COX enzyme we were just talking about. In addition to causing pain, COX also creates an enzyme called thromboxane, and thromboxane makes the platelets in your blood vessels incredibly sticky. When platelets get sticky, they clump together to form dangerous blood clots. These clots can get lodged in your blood vessels, leading to terrifying medical emergencies like a pulmonary embolism, deep vein thrombosis, or a myocardial infarction.
To quote our source directly, just to highlight the sheer drama of these conditions, basically, you're gonna die. Okay, it sounds extreme, but blood clots can absolutely be fatal. And here's the incredible takeaway. Because ibuprofen inhibits that COX enzyme, it stops the production of thromboxane. This means ibuprofen actually reduces your risk of blood clots and could pretty much save your life.
But it's time for a pivot. Section 5, the unexpected side effects, the dark side of the drug.
Whoa. Is it all drugs and smiles? Well, no, unfortunately not. Despite all those incredible benefits we just went over, ibuprofen can be pretty dangerous if it gets into the wrong hands or if you're using it incorrectly.
Frankly, some of the most common side effects are incredibly ironic. First up on the list, a headache. Yeah, it's totally counterintuitive that a drug used to treat headaches can actually cause one. Then we have diarrhea or constipation, literally two completely opposite symptoms caused by the exact same pill. Nausea and vomiting are also super common, which is basically just your gut reacting to an unusual chemical that makes you feel funny. And finally, itchiness. This usually means you're allergic to the drug.
I mean, think about how much that would suck, right? You're in pain, and it turns out you're allergic to the treatment? Tough break.
But the dark side goes way deeper than just an upset stomach or an itch. Let's go back to our old friend, that COX enzyme. As we've seen, COX is all over your body, doing all sorts of things. Some bad, sure, but some very good. For instance, COX actively maintains your gastric mucosa, which is the protective lining of your stomach.
And this leads to a severe collateral consequence. When ibuprofen swoops in and COX blocks to stop your pain, it's also accidentally blocking the maintenance of your stomach lining. This causes damage to the gut, which can lead to severe stomach pain and even gastrointestinal bleeding. Yep, stomach blood. Gross, right? But it's a very real risk if you rely on this drug too heavily.
Which brings us to an absolutely critical warning. If you are pregnant, you really need to listen to this part. Non-steroidal anti-inflammatory drugs like ibuprofen and aspirin can actually cross the placenta. This causes severe neonatal adverse effects, including malformation and even miscarriage. The source material is incredibly clear on this. Do not take ibuprofen and do not take aspirin if you are pregnant. If you are in pain, you must talk to your doctor to find a safe alternative for you.
So, we've journeyed through the science of pain, the incredible anti-inflammatory and life-saving benefits of ibuprofen, and the undeniable dark side of its side effects. It's a powerful tool, for sure, but one that demands our respect. I want to leave you with this final thought to consider before you reach into that medicine cabinet again. Knowing the heroic biological benefits and the dark side effects, how will you treat your next ache?